Good morning. I'm Dr. Borromeo. I'm an internal medicine specialist at the Red Lake Hospital.
Hi, I'm Carmen Briones. I'm one of the pediatricians at the Red Lake Hospital.
Hey, I'm Dr. Fredrico Tinsay. I'm also one of the pediatricians at Red Lake Hospital.
Yes, headaches and fevers can be associated with COVID. Some of the other symptoms, common symptoms of COVID, include having a dry cough, shortness of breath, body aches and pains, sometimes also a runny nose and fevers.
For the pediatric patients, so for younger ones, so they can be like very non-specific viral-like symptoms as well, which can be like the same symptoms that what Dr. Borromeo has mentioned. So they can have fevers, cough, cold, but it has not been shown to be as severe as the adults. But of course, there's like less number of pediatric patients that have been tested, so it's really very unclear right now what would be the more severe symptoms for them.
The virus is inactivated by high heat. However, if you have the virus in your body, you're not going to be able to get that heat up enough to, without harming yourself, to eliminate that virus. So we do still encourage patients to practice their traditional ways. We've always done that, and we respect that. However, I do not think that is a correct statement.
Also, it's important to be able to fight this virus is to stay as healthy as possible. Control your diabetes, control your hypertension, control your asthma. So if you stay healthy, the less likely this virus is going to do significant damage. So stay healthy and take care of yourself. I think I'll take that one. As far as of today, no one in Red Lake has the disease. We've been following the CDC guidelines and when to test and who to test. And so far, we've tested around 13 people using those guidelines, and so far, none have come up positive. So again, we need to stress to the community that, because everyone's stressing out about why aren't we testing so much, we're still following the CDC guidelines. I think Michael can expound on what guidelines were.
So yes, we have a screening procedure. So if you are concerned about having symptoms, we encourage you to call in. We have nurses who've been trained to provide screening. And because of the limitations in testing, and again, probably in the future, in the very near future, we are going to be ramping up our testing capabilities. So it's just because of the limited tests that we're being a little bit more judicious about who we test and who we don't test. But certainly in the future, the plan is really to be testing a little bit more widely so that we can determine the extent of the disease, especially in this community.
It's important to also let the community know that if you have any questions regarding if you need to be tested or if you have any health questions at all, we've expanded the Red Lake telephone services that's available. All you need to do is just call in. You'll be directed to either a peds nurse or an adult nurse, and the nurse will answer any questions with regards to COVID or any other health symptoms, and then they'll forward those questions to us if needed, and then we'll actually return those calls and go from there. Right now, we have the capacity to admit COVID positive patients, but we have to understand that if we do need, not all COVID patients need to be admitted. The majority of COVID positive patients will only have flu-like symptoms, and will just need home remedy, like staying hydrated and treating the fever. For those people that require hospitalizations, that require oxygen or breathing treatments, we do have the capacity to take those patients in our hospital. However, if they do need more advanced care, like ICU settings, like if they need to be put on a respirator, then those patients need to be transferred. Again, we do have the capacity to admit COVID patients who require extra help.
I'm just going to add to that. We're also expanding our inpatient capacity in anticipation of having more COVID patients in the future. I think, what we're doing now is certainly helping to, you've heard the term before, flatten the curve, and that just gives us time so that we can try and plan better and be better prepared for that eventuality. But as Dr. Tinsay said, if we have a patient who requires intensive care, we cannot provide ventilators in this setting and are likely going to need to be transferred to a higher level of care at another facility.